Ever wondered what that little blue pill known as Viagra, or its generic name Sildenafil, actually does? Widely recognized for their role in treating conditions like erectile dysfunction and pulmonary arterial hypertension, these medications are often hailed as wonder drugs. But like all medications, they come with their own set of caveats. Beyond the glossy advertisements and the high praise, there's a less glamorous side to these treatments, a side that's often overlooked, yet imperative to understand. Let's delve into the less glamorous side of these medications, their side effects. Viagra and Sildenafil don't come without their share of potential side effects. Let's begin by understanding the most common side effects associated with these medications and their potential impact on your health. First up, we have headaches. It is the most common side effect, with about 16% of users reporting this issue. It's thought to be a result of the widening of certain blood vessels in the brain. Next, we have flushing, or redness in the face, neck or chest. This happens in about 10% of users, and is due to the increased blood flow to these areas. Then comes an upset stomach, which is experienced by approximately 7% of users. This can range from mild discomfort to nausea and even vomiting in some cases. Abnormal vision is another side effect, affecting about 3% of users. This can include changes in color vision, blurred vision, or sensitivity to light. Moving on, we have a stuffy or runny nose, experienced by about 4% of users. This occurs due to the relaxation of the smooth muscles in the nasal passages, leading to congestion. Back pain and muscle pain are also reported by some users, affecting about 3% and 2% respectively. These tend to occur a few hours after taking the medication and can last for a couple of days. Lastly, there's nausea. While it's less common, affecting only about 2% of users, it can still be quite uncomfortable. It's often linked to an upset stomach, which we discussed earlier. Now, it's important to note that these side effects are usually mild and temporary. They tend to decrease as your body gets used to the medication. However, if these side effects persist or become severe, it's crucial to seek medical attention immediately. But these are not the only side effects. There are more serious ones to be aware of. In the following section, we will delve into the more severe potential side effects of Viagra and Sildenafil, so stay tuned. In some cases, Viagra and Sildenafil can lead to more serious side effects. It's essential to be aware of these, as they may require immediate medical attention. Let's start with sudden vision loss. This is a severe side effect that can occur in one or both eyes. It's not just about blurriness, we're talking about a significant decrease in vision or even complete loss. This effect is linked to a condition known as non-arteritic anterior ischemic optic neuropathy, a fancy term that essentially refers to damage to the optic nerve due to reduced blood flow. Next, we have sudden hearing loss or tinnitus, which is the medical term for ringing in your ears. This isn't your average ringing that might follow a loud concert. It's a persistent and often distressing sound that seems to come from nowhere. We also have irregular heartbeat. This isn't about skipping a beat when you see your crush. This is a serious condition where your heart rhythm becomes erratic, and it can be life-threatening. Swelling in your hands, ankles, or feet, also known as edema, is another severe side effect. This happens when your body retains more fluid than it should. It's not only uncomfortable, but could indicate a problem with your heart or circulation. Shortness of breath is also a concern. This isn't about being winded after a sprint, it's a situation where you're struggling to breathe even at rest. It could signify an underlying heart condition that needs immediate attention. Seizures are another potential side effect. A seizure is a sudden surge of electrical activity in the brain. It can cause changes in your behavior, movements, or feelings, and in levels of consciousness. Lastly, there's a lightheaded feeling like you might pass out. This is more than just feeling dizzy, it's a severe feeling of unsteadiness and a sense that you might lose consciousness. These side effects are certainly intimidating, but it's important to remember that they are not common. Now, you might be wondering, how common are these side effects? Stay tuned as we delve into that in the next segment. So, how often do these side effects occur? Well, the truth is, it's not a one-size-fits-all answer. The frequency of side effects varies greatly among individuals. Some people may never experience any, while others might encounter one or more. However, it's crucial to remember that the occurrence of more serious side effects is relatively rare. Let's start by talking about the more common side effects. These include headaches, flushing, upset stomach, abnormal vision, stuffy or runny nose, back pain, muscle pain, and nausea. If you've taken Viagra or Sildenafil, you may have experienced one or more of these. Statistically speaking, these side effects are more common but are often mild and temporary. On the other hand, some side effects are less frequent but more serious. These include an erection that will not go away, sudden vision loss in one or both eyes, and sudden hearing decrease or hearing loss. While these sound scary, remember, they are quite rare. However, it's essential to be aware of them so that you can seek immediate medical help if you do experience any. Now, it's also worth noting that the likelihood of experiencing side effects could be influenced by other health conditions or medications. For instance, if you have heart disease or high blood pressure, or if you're taking certain other medications, you might be more likely to experience side effects. The same goes for those with liver or kidney issues, or if you're over the age of 65. Your body might metabolize the drug differently, leading to increased side effects. It's always a good idea to discuss any health issues or medications with your doctor before starting any new treatment. In summary, while the side effects of Viagra or Sildenafil can vary greatly among individuals, the more serious ones are relatively rare. However, certain individuals may be more susceptible due to other health issues or medications. But what should you do if you experience these side effects? It's important to know what to do if you experience any of these side effects. Let's not forget that while Viagra, or its generic form Sildenafil, can be beneficial, it's not without its potential downsides. That's why it's crucial to have a plan in place if you start to notice any of the side effects we've discussed. First and foremost, if you experience any serious side effects such as a sudden loss of vision, hearing, or an erection that lasts more than 4 hours, you must seek immediate medical attention. These are not common occurrences, but they are serious and require urgent intervention. For less severe side effects like headaches, flushing, or indigestion, it might be tempting to dismiss them as temporary inconveniences. However, if these symptoms persist or become bothersome, it's essential to consult with your healthcare provider. They can offer advice on managing these symptoms or may suggest adjusting your dosage or trying a different medication. Stopping the medication is another option, but this should never be done without first consulting your healthcare provider. A sudden stop can lead to withdrawal symptoms, or a return of the symptoms that prompted you to start the medication in the first place. Remember, every individual is unique, and what works for one person might not work for another. It's all about finding a balance between the benefits of the medication and the potential side effects. Before starting any new medication, including Viagra or Sildenafil, a consultation with your healthcare provider is a must. They can provide you with the most accurate information based on your health history and current medications. And let's not underestimate the power of lifestyle changes. Regular exercise, a balanced diet, and limiting alcohol can all contribute to improving your symptoms and reducing the need for medication. Remember, knowledge is power, and understanding these side effects can help ensure a safer use of Viagra or Sildenafil. You are your own best advocate when it comes to your health, so stay informed, ask questions, and always prioritize your well-being. So, let's summarize what we've learned about the side effects of Viagra and Sildenafil. Our exploration has shed light on the myriad of potential reactions ranging from minor discomforts to serious health risks. First off, we delved into the common side effects, which include headaches, flushing, or upset stomach. These minor discomforts are typically temporary and may diminish as your body adjusts to the medication. We also navigated the more serious landscape of potential side effects. This includes sudden vision loss or hearing loss, which, though rare, are serious conditions that require immediate medical attention. Our journey also uncovered the frequency of these side effects. While the common side effects are relatively frequent, the more serious side effects are quite rare. However, it's crucial to note that each individual's reaction to the medication can vary significantly. Finally, we discussed how to deal with these side effects should they occur. Remember, if you experience any discomfort or unusual symptoms, it's always best to consult your healthcare provider immediately. They can provide personalized advice and adjust your treatment plan if necessary. In conclusion, while Viagra and Sildenafil can be beneficial for certain conditions, it's important to be aware of the potential side effects. Knowledge is your first line of defense. Stay informed, stay safe, and always consult your healthcare provider for personalized advice.